Call the meeting to order. Good morning, everyone. I think this is our third meeting of the Sunset Subcommittee. And if everybody's ready, I think we're waiting for Senator Lang, but we'll mark her present when she comes. So, Madam Secretary, can you please call the roll?
Senator Hansen,
Here.
Assemblywoman Backus,
Present.
Assemblywoman Marzola,
Here.
Assemblyman O'Neill,
Here.
Chair Daly.
Here. So with that, I want to welcome everybody who's joining us either remotely or here in person. A few housekeeping items that we begin every meeting with. We want to make sure that you've muted any type of cell phone, electronic device, mute your computer if you can, so we don't have noises going off. Members on Zoom, which we don't have any today unless Senator Lang shows up on Zoom. Be sure to keep your video turned on so we can ensure we have a quorum. Mute your microphone when you're not speaking. Witnesses under public comment who wish to provide the subcommittee with additional information or have their complete testimony or handouts included in the permanent record should provide paper or electronic copy to the secretary. Information on how to do that is provided in the subcommittee's website, and I believe it's on the agenda as well. When testifying, please remember to begin by turning on your microphone and clearly stating your name and the entity you represent. If it's an uncommon name, please give us the spelling so that we have that. Meeting materials provided to the subcommittee can be accessed on the webpage, and anyone who would like to receive electronic notification access to the subcommittee's agendas, minutes, and final report can do so by going to Nevada Legislature's website. Links are provided. With that, we can get started with agenda item number 2, which is public comment. So we'll open public comment. We'll start here in Carson City. I'm not seeing anybody come up. So we'll go next to Las Vegas. If there's anyone present in Las Vegas that wants to give public comment. Nobody there?
There isn't, Chair.
Okay, very good. With that, broadcasting, do we have anybody on the phones wishing to provide public comment at this time?
Thank you, Chair. There are no callers to provide public comment at this time.
Well, seeing as how we have none, we would have limited it to 2 minutes if we did have some, but we will have public comment again at the end of the meeting, and we'll go through that as we get going. So with that, we can move on to agenda item, where are we at? Number 3. Huh? Yeah, agenda item number 3, which is the minutes for the 2/27/2024 meeting. All of the minutes should have been provided to everybody on the committee. So at this time, I'll ask if there's any corrections or issues that somebody came up with. If not, we'll accept the motion.
So moved.
Second.
Okay. So we have a motion by, who was that down south made the motion?
It's Vice Chair Marzola.
Yeah, Vice Chair Marzola made the motion. We have a second from Senator Hansen. Anything on the questions? All in favor, signify by saying aye. Aye. Any opposed? Motion carries unanimously. Thank you. Okay, with that, now we'll get into what we're here for, and we're going to have as much fun as we can today on this Hump Day Wednesday. We'll go to agenda item 4A, which is the public hearing concerning termination, modification, consideration, or continued operation of certain entities pursuant to 232B.240. So first up is the Advisory Committee on Medical Innovation. We have Melinda Southard, Deputy Administrator, Division of Healthcare. Please proceed when you're ready.
Good morning. Thank you, Chair and members of the subcommittee, for asking me to present here today. For the record, my name is Melinda Southard, and I'm one of the Deputy Administrators for the Division of Healthcare Financing and Policy, otherwise known as Nevada Medicaid, overseeing community supports and engagement. My remarks today are in regard to the Advisory Committee on Medicaid Innovation, or ACMI. From historical documentation, division staff have been able to locate the ACMI first met on June 24th, 2020, again on July 24th, 2020, and lastly on September 30th, 2020. During these meetings, the ACMI delegated a chair and co-chair, approved a letter to the Patient Protection Commission regarding a bill draft request topics on value-based care, approved bylaws, and received an informational presentation of a high-level overview of Medicaid from a national perspective, followed by discussion. The ACMI has not convened since its last known meeting on September 30th, 2020. Being that I am new to the division, we did our best to search for all historical documentation we could find, but could not find any evidence as to why the ACMI did not meet after that date. We speculate it may likely have been due to quorum issues related to other priorities of the ACMI members during the pandemic. I also reached out to the former members of the ACMI that I could still find that are still active in the state, which resulted in a total of 5. When asked, the former members stated in comments that the ACMI did not focus on identifying the greatest issues and letting Medicaid come back to the members with innovative ways to solve, as I think may have been the intent. The former members continued, referencing there is now new leadership at Nevada Medicaid with a lot more comprehensive knowledge of payment options and system solutions, relaying there is not an urgent or critical need for the ACMI to fulfill. Another former member mentioned that meetings of various working groups on specific tasks or projects with key stakeholders seem to be more productive than this formal working group, required to meet quorums and comply with open meeting law. Another consideration is to note the ACMI was codified in statute in 2017, but for reasons unknown was not first convened until June 24, 2020. Additionally, gleaning from the exhibits of the original bill in 2017 for the ACMI, which was Senate Bill 366, an aligned need of the bill was to gather an annual report which discloses certain employers of the state that have over 50 employees employed full-time who are enrolled in Medicaid, and whether the employees have access to an employer-based health plan. This need is satisfied and ongoing with the annual published report from the Department of Health and Human Services Office of Analytics in accordance with NRS 422.27482. With regard to the statutory language referencing the duties of the ACMI to study the manner in which to create or expand public or private prescription purchasing coalitions, this is something that is already being worked on outside of the ACMI within the Department of Health and Human Services as we look at better ways to leverage purchasing power within Nevada Medicaid. Current work on this issue is driven by the public workshops regarding the statewide managed care effort. The second duty outlined in statute for the ACMI to study the manner in which to encourage access to employer-based health insurance plans, including providing assistance to a person who is eligible for Medicaid, to allow that person to purchase private health insurance. So this duty is additionally addressed outside of the ACMI in that Nevada Medicaid already pays for premium support for private health insurance. Additionally, the Patient Protection Commission may be a better avenue for both of these conversations as we look to get more people enrolled in coverage, and might be a good avenue for that work moving forward. Lastly, Nevada Medicaid currently manages the Medical Care Advisory Committee pursuant to NRS 422.151 to 155, which meets quarterly, with the goal to advise Nevada Medicaid regarding the provision of services for the health and medical care of welfare recipients, and to participate and increase the participation of welfare recipients in the development of policy and the administration of programs by Nevada Medicaid. The Medical Care Advisory Committee includes in its annual report to the division opportunities to improve Nevada Medicaid. I highlighted this active committee because per ACMI statute in NRS 422.165, subsection 2, at least once per year, the ACMI shall make recommendations to the director of the department as it deems appropriate relating to opportunities to improve Medicaid or to increase access to health insurance. So the first part of this activity seems to be upheld in the ongoing work and recommendations of the Medical Care Advisory Committee, while the Patient Protection Commission may again be a good outlet for the second portion in recommendations to increase access to health insurance. It is for these reasons brought forward today that it is the agency's recommendation the ACMI be terminated. I'm happy and available to answer any questions. Thank you.
Thank you for that. And I'm assuming we'll have some questions from the people that wanted to hear from you in the first place. So committee, any questions for the ACMI board and their recommendation?
Chair, this is Assemblywoman Backus, if I may.
Yes, please proceed.
Okay. I just wanted to thank you so much, first and foremost, Ms. Southard, for your presentation. I really appreciate how you broke down each of the duties of the committee and where work is being performed by the division and or other committees. I did miss one that I wanted to just confirm with you is you indicated that there was a working group, and this was right above the quarterly Medicaid services. And I just wanted you to dive into that a little more, and then I have one more question, if I may, Chair.
Thank you for the question. Melinda Southard for the record. Just to clarify, were you referencing the Medical Care Advisory Committee that meets quarterly?
I feel like it was one spot right above that. It was one of the categories you were talking about, and then you said there's a working group that's moving forward.
Oh, yes.
So it would have been right in that presentation.
Yes, thank you. I'm so sorry about that. Yes, so I was referencing the Nevada Patient Protection Commission, as it has a really diverse group of stakeholders. There's 12 commissioners there that are all governor appointed, and there are, I think, 2 spots that are also legislatively recommended on that commission. And the goal of that commission is to improve the accessibility, affordability, and oh my gosh. There's another one of healthcare in the state. And that commission, while has been dormant for about a year, I believe, is looking to reactivate. And I think that, you know, the conversations that were intended for the ACMI might be a good platform to propose to the Patient Protection Commission members as it relates to healthcare and increasing accessibility to health insurance in the state. Thank you.
And thank you so much for that detailed explanation. And that may go into my next is I wanted to see you had talked about the study for public prescriptions, leverage that with what Medicaid was doing in the division. But it sounds like as to the one gap of maybe private prescription costs, that would be something good that could be for this other working group that we just discussed regarding the Nevada Patient Protection Committee. Maybe expand that. Well, a recommendation with you guys was to close down this committee, but where there's like maybe some voids that aren't being addressed, we could put them into the Nevada Patient Protection Commission.
Melinda Southard for the record. Yes, that is correct.
Thank you so much.
Thank you. Anybody else have any questions at this moment? I just have a couple and not really difficult questions. Obviously, we're looking at your recommendation, which is to terminate this committee, and along the lines that Assemblywoman Backus had as well as. So I was just looking up when the bill came in 2017. I think it was Senator Cancella that brought it forward, and it had to do with Medicare funding that came through in relation to COVID and a couple of other issues that were going on at the time and the expansion of people being covered by Medicare. So I think the intent was to try to capture some information that was going to be related to this new funding. So along the lines of what Assemblywoman Backus was just saying, so some of the work that this committee was supposed to do, and we're not sure they ever really got off the ground, do you believe there's some of that work already being done, so the state has evolved and we're capturing some of that information?
Melinda Southard for the record. Yes, that is correct, Chair. A lot of this work is already being done outside of the ACMI, working with other key stakeholders on these topics and with the expansion of statewide managed care as well.
So on those, is it just being done as what you believe is part of your duty, or is it statutorily recommended? So I guess the question is, if we terminate or make the recommendation, except yours, to terminate this particular board, is there any additional recommendation on shifting some of the responsibility to other existing boards instead of just leaving it, well, they're doing it now, but there's no requirement to continue? And not that we want to have additional regulation, but there are certain data sets that we may want to continue to capture, and we want to make sure someone's responsible for that. So I'm asking if you would go back to your people and maybe enhance your recommendation a little bit and say, hey, these are the things that are already being done. These are the statutes that require us to do these things. And if it's not required by statute, or there's additional data sets you think that would be useful, we can use that. We would like to have that recommendation.
Melinda Southard for the record. Yes, Chair, I'd be happy to get that recommendation for you from the agency and send that through Patrick, if that's all right.
I was going to suggest that. No, yes, send it through Patrick. It will get out to the rest of us, and we'll go from there. But and that'll kind of be the theme on some of these as we go through the boards and various things today. Is there are some useful information. There was a bill that was passed. It got signed by the governor. So there was at least a perceived need through this body to have it. And we just want to make sure that we're doing the best we can for our citizens to have the best information given back to us as well, so we can make the policy decisions that need to be made as we move forward. So I will look forward to additional recommendations on how we can streamline, but then also make sure we're still effective. And that's why we added the question on, is there another board that's duplicating these types of things already? We don't want to duplicate, and we want that efficiency. Thank you. Committee, any other questions before we let her go? All right, we're seeing my two colleagues here in the north, they were done when you said recommend, sunset. So, so anyway, I'll look forward for that recommendation. And June 30th is our deadline to report back to the Legislative Commission. So thank you. Okay, we will move to our, let me get back to the right screen here. Next agenda item. Which is agenda item 4B. So we have the Advisory Committee on the Rights of Survivors of Sexual Assault. I believe we have Chief of Staff Benitez Thompson in Las Vegas, representing the Attorney General's office. At least that's what I was told, was she's going to be in Las Vegas.
Yes, good morning. Hello, good morning, Chair Daley, good morning, Commission members, subcommittee members. It's a pleasure to be here this morning. I also have members from the Attorney General staff down in the Legislative Building in Carson City as well. Nicole Riley, who's our ombudsman for victims of domestic violence and sexual assault, participated in a number of these meetings. So as more detailed questions come up, maybe around the conversations or the context of those meetings, she'll be able to provide more information there. I've got historical information to provide for you. So as the Sexual Assault Survivors Bill of Rights exists in Chapter 178A. It was created through the passage of Assembly Bill 176, sponsored by Assemblyman Yeager, then Assemblywoman Benitez Thompson, Krasner, and Moreau Moreno, and where this and joint sponsor of Senator Canizaro. So where this legislation grew out of is in the prior year, there'd been lots of conversations about the backlogs of sexual assault kits, the fact that they were sitting not unaccounted for, but in terms of quantity, different types of processes through law enforcement agencies, some being held in boxes, some being in more formalized data collection process. So there was an attempt to standardize and know exactly how many kits we have out there and how much of a backlog that there was. Money was appropriated through a separate bill the session before to allow for law enforcement agencies to count all of the kits and then start getting them to the labs and getting them processed. I participated in a lot of those conversations as an assemblywoman with then AG Laxalt on the committee. He stood up around sexual assault kits to talk about the conversation came up, once we start moving these kits, how are victims going to know that these kits are moving, especially some of the kits were more than 20 years old? How are they going to be notified? And then are they going to want to follow through with prosecutions, especially if it's a very older kit? So we became very sensitive to the fact that we needed to have more conversation and dialogue around victims rights, and make sure that we were standing up rights, that these kits weren't going to be taken and prosecuted without the consent of the victim, that they wouldn't be forced into a process that might be re-traumatizing for them, that they needed to provide consent because that consent is empowering and ultimately what wasn't there during the course of the sexual assault. So this bill, Assembly Bill 176, with the mandate to stand up a sexual assault survivors' Bill of Rights is what came. The Office of Attorney General participated in that work and hosted that work. We were provided two different pots of money, $150,000 in each fiscal year, to allow for training out to partner organizations in the community, so that once the sexual assault Bill of Rights was established, then there could be training around it. This was during the time of the COVID recession. The state had to do a lot of clawbacks, lots of special sessions to pull money back. So unfortunately, one of those delegations, or one of those chunks of money, $150,000, was reverted back to general fund. What we did in the Attorney General's office with the help of our grant unit was to identify other grant dollars that could still support and continue this project. So we were able to do that. We were able to find money to supplant the money that was reverted back during the 31st special session. You have as an attachment for you the Bill of Rights that was created for you. It outlines to the survivor of sexual assault different numbers where they can receive support, their right to a forensic medical exam. We explain what a sexual assault nurse examiner is. We explain then what the sexual assault kit is and the typical process that happens with that. There's a section there that describes your rights to the police, your rights with the police, your rights to be protected, and then additional resources to help them where they can find more information for support and help. The biggest mandate of that bill was to produce this Bill of Rights, to draft it, to get input from stakeholders and let the advisory committee come up with this Bill of Rights. And that was accomplished, and that does live out there in the community. It would always be nice to have more resources to make sure that it is as available as it can be, but it does exist, and the advisory committee was very happy that they felt that they accomplished one of the main missions of the goal by making this happen. As well, if you want to go to the Attorney General's website, there were two attachments that we were hoping to attach to you. One, the Rape Crisis Center report, and one was the Trainers Sexual Violence Advocacy. Those were ones that the partner members of the advisory committee produced for the community. They had different logos in them, and so they couldn't be, I don't think, attached formally to these minutes because of the logos that were in there and the graphics that were in there, but they do live on our Attorney General website as work products that were done. So at this point, at the last time the committee met, it was December 12th, 2022 at 9 a.m. That was, I think, about the third week of my employment with the Attorney General's office. It was one of the first meetings I got to attend. And within the course of that meeting, the conversation was that the advisory committee felt that main objectives had been accomplished And there was discussion at the end about whether or not it might make sense to look at sunsetting the committee or look at a new direction for the committee. Obviously, then went into legislative session, and so almost all of our community members are involved, or the advisory committee, when you look at the composite of that committee, are involved in advocacy in session for their organization or for their community or for their law enforcement agency in some way or form. And so, but even before the Sunset Committee called us, there was this notion that it felt like the advisory committee had done the bulk of its work. In terms of looking forward, because there is a lot of really great language in Assembly Bill 176 that talks about how do you keep eyes on the ball to ensure that there's kind of constant conversation about victims' rights. And so the Attorney General's office at the time that AB 176 was passed, we didn't have victim witness advocates. We really didn't have really any victim supports that were out there. Last session, you all were so kind enough to grant us 2 full-time positions for victim witness advocates. We recruited and hired for them. They've been on the job now for 3 months, and they are setting up the Attorney General's first ever victim witness advocate program. We've had lots of discussion with NDOC around this. We've had lots of discussion with partners as to what our internal program would look like. Additionally, at the April 11th IFC, we're going to be looking for approval to accept a grant from the Department of Justice to establish a hate crimes hotline, and that's going to come with 3 positions, one of them being a victim support person. And so we kind of have now organically within the office, we're organizing victim services and victim support. So it's something that we're now thinking of every day and have staff in place to do every day. Nicole Riley, who's in Carson City, has kind of been the lone person in an organization of about 400 that really got to focus on victims in a way that was attentive to their needs and wasn't necessarily about the prosecution or the defense or about all of those kind of other legal things, but really just about needs for the victim. And so we'll have a much more hardier and robust unit, if you will, regarding victim rights and what the office is doing to support victim rights. That being said, the next committee on domestic violence is meeting at the end of the month, and they've agendized an item to consider consolidation for the ongoing work of the victims of sexual assault within their committee. There's a lot of overlap between the members. Right now, the Committee on Domestic Violence has a subcommittee that's talking about the issues around the sexual assault nurse examiners and around availability of sexual assault nurse examiners and around advocacy as well. So those conversations are continuing. There is a group having those conversations. It seems like it might make the most sense to consolidate those into one spot. And we are ready for questions. Thank
you for the presentation. I'm not sure what Chief of Staff, I guess, Benitez Thompson. Committee, any questions as we go forward? Yeah. Senator Hansen.
Thank you. Teresa, great to see you again. The original problem was the number of kits that existed, the backlog. Are there still kits that are in backlog, or what's the status of the original problem?
Thank you so much, Senator Hansen. Thank you for the question. So those are now, the Office of Attorney General, with the dollars that were granted, began the backlog initiative. Once the backlog was completed, a couple of years ago, it was completed, but you still want to look at kind of like the equilibrium homeostasis. Like, just because you get a backlog doesn't mean it can't be, re-backlogged, right? But the duties for tracking those have shifted over to the Department of Public Safety. If you've been on their website, they have a crime statistics reporting area, and they track the sexual assaults. They also track the kits. And I believe, I don't want to speak out of turn because it's their work product, but I believe they've got a work product where they're publishing within their crime stats reports on those kits. We get questions about them still frequently, so we do work with DPS when we get those questions and people inquire, like, what is happening with it. So we keep our fingers on it a little bit, but the responsibility for tracking them has moved to another agency.
Okay, well, as far as you know, the backlog's not there anymore. I mean, they're keeping current with whatever sexual assault kits they get now, as far as you know.
It says it's current. I would say that there's still, that at different points in time, there might be some that are trailing out there, but we have not received a word that there's a growing backlog. I don't know, Nicole, if you're down there, I know that the Committee on Domestic Violence, I don't know if they've had recent conversations on that, but no one's, not anything like we were seeing, right, going into 2017, no.
Hi, Nicole Riley for the record. Thank you, Chair and Subcommittee members. I can just add to that. There, in the process of tracking those, a data collection system was created. So it immediately gets put into the system, and then the victim gets to log in and can watch where their kit is in the process of the system. And they still have all the rights of whether they want it to go forward with prosecution or not, and to have victim advocates present with them during interviews and such. But that database system does exist, and that's what's keeping track of everything. So like the Chief of Staff stated, if you wanted an update on that, then DPS would be able to give you a full update on what's happening there.
Okay, well, I might have got us off track a little bit, but the bottom line was the original purpose of the committee was to create the Bill of Rights. The Bill of Rights have been created. You didn't formally, Chief of Staff, actually come out and say you think it would be all right to sunset it, because obviously one of our goals is to eliminate surplus or excessive things or combine them into another thing. Did you actually have a formal recommendation, or are you just leaving that up to us? The impression I got is last time you guys met was December of 2022, and the purpose has been met. So are you guys recommending consolidation or elimination?
Thank you so much for the question, Senator Hansen. So what we want to do is we're feeling confident, and the advisory committee itself was feeling confident that that's the direction that they wanted to head. But in order to do our due diligence, we want to make sure that those conversations around the sexual assault nurses and around support to victims would be comfortably housed as a formal item within the Committee on Domestic Violence. So that they have that on their agenda for consideration at the end of this month. So I believe your guys' drop dead date for recommendations is June 30th, but well in advance of that, we'll be able to follow up after that meeting to let you know from their conversation whether there was a vote by that board to kind of take up that work and continue. They do have a subcommittee that's addressing the sexual assault nurses and that process there. We want to make sure we've got it all documented on paper.
Okay, very good. Thanks, Mr. Chair.
Thank you. Committee, any other questions in the South?
Chair, Assemblywoman Elaine Marzola, my colleague Assemblyman Hansen asked my question about sexual kits, but I do want to say thank you so much for coming in today. I requested that you guys do your presentation today because it worried me a little bit when I saw that the last time that anyone had met was December 2022, but a lot of work I see has been done since then. So thank you so much for that, and I appreciate that. And just like you stated, after the March 2024 meeting, if you can just let us know the results of that meeting, that'd be great. Thank you for being here today.
Thank you, Vice Chair. Any other questions? Right, then, just
No,
go ahead, Assemblywoman. No?
No.
You sure you don't have a question? I'm just kidding.
I was going to say, because Nicole Riley's down there and she's involved in both committees, I didn't know if there was anything more that she wanted to add. She's a wealth of knowledge. Obviously, her title within the Office of Attorney General combines the domestic violence work and sexual assault work. It's where most of the nonprofits have gone, is to kind of create umbrellas where both those issues are being addressed. And so that's why we're looking to consolidation with the Committee on Domestic Violence because of our nonprofit partners and the way that they've been trending with that work. But if Nicole wants to add anything else, because there's a lot that's going on, I don't want anyone to be left with the impression that the advisory committee but for the advisory committee, these conversations aren't happening.
Go ahead if you have anything.
Nicole Riley for the record. I just wanted to add that previously, before last session, we actually had a conversation in the Committee for Domestic Violence about whether we wanted it to include domestic violence, sexual assault, and human trafficking, as that we were expanding my title statutorily to include human trafficking. And that committee voted to have the committee be about domestic violence and sexual assault because they do intersect to such a degree, and that the majority of sexual assaults occur by people that they know. Those made sense to work on. And then we have the Nevada Coalition to End Domestic and Sexual Violence, who is a really close hand-in-hand partner with us. And so they had voted to do that and then keep human trafficking separate. So they've already decided to do that. And in doing that, we've been moving forward with two subcommittees, the Forensic Nursing Subcommittee and the Data Subcommittee. The Forensic Nursing Subcommittee is taking into consideration not only sexual assault nurse examiners, but also strangulation forensic examiners. And so we're looking at propping up forensic nurses around the state. And if we prop up forensic nurses, that encompasses both. So that one nurse will be able to provide both of those exams. And then in the data subcommittee, which is one of the tasks that was in SB 176, and there was no data available to collect, and that continues to be an issue with domestic violence and sexual assault and human trafficking. So data collection is a conversation that has been a lead for the Committee on Domestic Violence. We created the Data Subcommittee this year, and so they're looking at what we could possibly do to correct the data reporting and monitoring collection, all of that issue for both domestic violence and sexual assault.
And thank you for that update as well. So if there's no other questions, I just may have one at the end, but a comment at this point. So thank you, Chief of Staff Benitez Thompson, for a very thorough report. And in summary, as Senator Hansen said, is the committee, as originally found, has completed its work. You did the Bill of Rights. You had some dollars to allocate. You did that, reverted some back to the state. But you have other grant writing, various things to move forward with that. And I understand your recommendation is you want to get the advice of the committee first. You'll report back to us on any additional recommendation. But one thing that you said was some of these other issues are being picked up by other committees and various things, and it was developed, I believe the word you used was organically within the AG's office. So with that, I guess I would ask you if you have a comment now or if you want to include in your recommendation that a lot of this data points and victim advocacy and various things, if it's just something that this AG's office has kind of built and expanded upon because they find it important, I think the legislature would find it important as well. And if we have a different AG and as time goes on, is that going to continue, or is it a discretionary type of endeavor? And if it's purely discretionary and those full-time employees can be moved to other issues, could you give us a recommendation on how we can make sure that we're continuing with a lot of this work for victims?
Thank you so much for a question, and I appreciate that because the continuity and support of the issue is most important regardless of which administration is holding the office and what's happening, right? So the good thing is that I think regardless of the partisanship of the Attorney General's office, that you've seen some consistent work. So initially work started under AG Laxalt's administration, carried forward and finished the backlog under AG Ford's administration. So that work, I think, because of how important it is really, and because of the work that the community partners do, it's going to continue and move on. What I think will, with the vote on the Committee on Domestic Violence next week, but coming up towards the end of the month, one of the considerations might be what of the specific language that's obligated by, that looking forward on how to track and how to follow things, that's living under the advisory committee statute might need to be moved over to the domestic violence committee statute to make sure that exact thing, that certain tenements that we really want to have discussed ongoing are moved over and embedded in that language, because those subcommittees might moderate and change over time within the Committee on Domestic Violence. So we'll just make sure that we've kind of got a good language match, if you will, between the sunsetting of this and then the more formal rolling over into the Committee on Domestic Violence. The two positions that the legislature gave us, the PCNs are specifically for victim witness advocate positions, so they cannot do anything other than that work.
Excellent, thank you. And you used the word that I was looking for, which is the continuity between administrations and various things. And I don't think this is a partisan thing. It's what we should be doing for the citizens of the state. But we do want to make sure, so we'll be looking for that recommendation. I'll tell you the same thing we told the previous presenters is, get us that recommendation on sunset, moving it over to other locations. And obviously that can be done either through this committee after we recommend to the sunset or to the legislative commission, or I know the Attorney General has bill drafts that they can put in as well. And hopefully we can coordinate that and make sure we get it right. With that, any other questions from the committee? Seeing none, thank you for that presentation, but don't go anywhere because we'll move on to agenda item 4C, which is the Technological Crime Advisory Board. Again, Chief of Staff Benitez Thompson, you're up.
Thank you so much. Once again, Chair Daly and members, thank you so much for hearing this. So we've had a lot of internal discussion at the Attorney General's office around the relevancy of this task force. AG Ford, when he was then Senator Ford, served on this task force, and his recollection was the same that we've been able to document for recent history, which is it's very hard to get a quorum. So the last time the committee met was in June, on June 22nd, 2020, and since then it had failed quorum on June 30th, 2021, March 30th, 2021, December 10th, 2020, and September 21st, 2020. So I think ultimately the office just stopped trying. This predates my time with the Attorney General's office, but our historical recollection was it just didn't feel like there was enough energy there specifically. Also, there was a natural evolution of the conversations around tech crimes that were very different from when the committee was first stood up by Attorney General Frankie Sudell Papa in the late 1990s. So when the task force was initially committed, these tech crimes were very novel, they were very new. Law enforcement agencies were figuring out how to tackle them, how to address them. And then in that time, what you've seen is specific subject matter task force have popped up to address specific crimes rather than just it being an all-encompassing umbrella of tech crimes, because that umbrella is so big that I just don't think that there's any way that you could get stuff done. So for example, we have the FBI's Northern Nevada Child Exploitation and Human Trafficking Task Force, and a lot of that has a cybercrime component and tech component and use. We're working right now with law enforcement partners, actually Metro down here in Las Vegas, on a grant through the U.S. Department of Justice, Office of Violence Against Women, on 2024 local law enforcement grants for enforcement of cyber crimes. So that work that we're supposed to do with local law enforcement, we're doing especially in the grant space. And we do a lot of digital and forensic analysis to help out our local law enforcement partners as well. In 2017, in terms of kind of duplicative work that's already out there in the state, the legislature created the Office of Cyber Defense Coordination, and that's housed in the Director of Public, with the Director of the Department of Public Safety. That's NRS 480.920. And they're tasked broadly with assessing risk behavior, vulnerabilities to information systems in both the public and private space, and to develop best practices for preparing for and mitigating risk. And it's my understanding that the director has assigned the Office of Cyber Defense Coordination to work in coordination with the investigations divisions through the Nevada Threat Analysis Center, which was established in 2008. So there's other folks kind of in this space doing the proactive work, the education work, the look at the Nevada's systems. And we continue, the Attorney General's office continues to engage very robustly in these conversations. Our Consumer Protection Division regularly puts out announcements about frauds and scams, lots of frauds, lots of scams, and they are savvy people who are often outside of the United States or outside of the state of Nevada. And so we have these we work with our federal partners a lot. We have these cross-sector teams that work on tech crimes in lots of different kinds of ways. So we are feeling fairly confident at this point that the work's going to continue in a robust way, regardless of not if the advisory committee is in place or not.
Thank you. Committee, any questions for Chief of Staff Benitez Thompson? Assemblyman O'Neill, thank you.
Thank you, Chair, for the time. In short, the summary of what you just said, the committee can be killed. It's no longer necessary. It's being handled already. Is that fair to say?
To your point, we see no negative consequence of the advisory committee continuing to not meet or to not exist. We do, though, need within the chapter the definition of a technology crime. That is the only spot where that definition exists. So we don't want you to draw a red line through the whole thing. We do want to keep 205A 030 technological crime defined. And what we can do through one of our BDRs is move that into our chapter, our Attorney General's chapter and Attorney General statutes, so that way it's existing under our statutes. Right now, it's just a reference back to this statute.
Very good. Thank you. Thank you, Chair.
Okay.
Committee, any other questions? Down south? Seeing none. And thank you again, Chief of Staff Benitez Thompson. And I was just going to reiterate a little bit on the summary, like you say, in Assemblyman O'Neill's question. So I think cyber crimes, technological crimes have evolved, and they're evolving faster than this committee would be able to do. You said it was clear back under Attorney General Del Papa. In that the enforcement and trying to keep up with that has also evolved. The Department of Public Safety and the Cyber Defense offices within the Attorney General's office. So I understand your recommendation. We want to make sure we're keeping up with this. I think we need to make sure we have broad language, like you were just referencing, so that as it evolves, we don't have it nailed down and, oh, we can't do this because this is a new thing we haven't thought of, because it's all coming. And it's moving faster than some of what we can get done. So yes, I appreciate if you can come back to us, same as the previous two that we've had now, with the recommendation on if we want to sunset this, what parts you might want to keep. I know you mentioned that you may just use one of the AG's bills, but we need to coordinate with that as well. So if we do a recommendation to sunset, I think we need to make sure that there's a bill on the other side, or if we want to do a recommendation to sunset, but to move that language over to the AG's office. Then you can have a companion bill if you need resources or something like that. But making that move, I think, is the right way. So anything further to add?
No, I'll brag a little bit on the office because we don't always get a chance to do so. So Attorney General Ford is hosting through the Attorney General's Alliance a number of different attorney generals who are in Las Vegas this week to talk about consumer protection and especially within cybercrime and cybercrime space. And the Federal Trade Commission chair is going to be joining him as we talk about the ever-evolving landscape. So artificial intelligence, scams, prosecutions, joint efforts across multi-states and work with the feds on this stuff. So these conversations are really robust and hearty. I don't want it to be lost on anyone that the crime is still out there. The advisory committee can go away, but the work is very robust.
And thank you, and that's what we wanted to make sure we're capturing, and you'll get back to us with a recommendation if you can send it to our policy analysts, and we'll take it up at a further work session. But we do want to make sure that you're included in what we recommend to the Legislative Commission so we get it right. Anyway, thank you. So we'll move on to our next agenda item, which is still agenda item 4, and we're on agenda item 4D. The task force on safe sidewalk vending. We have Maggie Solis Crespo, I believe in Southern Nevada.
Hello, yes, Southern Nevada.
Yep. Please proceed, and we look forward to hearing your presentation.
Of course. Good morning, Chair Daley, Vice Chair Marzola, and members of the Sunset Committee of the Legislative Commission. My presentation is going to be a little bit lengthier than the previous presentations, only because this is a very new task force, and so I want to make sure you have a full understanding of the task force, their duties, and what we've done so far. My name is Maggie Salas Crespo, for the record, and I serve as Deputy Secretary of State for Southern Nevada. In this role, I oversee the functions of the Task Force on Safe Sidewalk Vending. The Task Force on Safe Sidewalk Vending, which I'll refer to as a task force, was created through Senate Bill 92 from the 2023 legislative session. Section 12 through Section 14 of this piece of legislation sets forward the creation of the task force within the Office of the Secretary of State, along with the membership of the task force and the duties of the task force. As prescribed by Senate Bill 92, Section 12.2, the task force is comprised of the following: a representative of a health district in a county whose population is 100,000 or more. This position is currently filled by Joel Gutman-Dotson, Government Affairs Liaison for the Northern Nevada Public Health. A representative employed by a county or a city whose primary duties are to perform the tasks related to business licensing. This position is currently filled by Vincent Keano, Director of Clark County Business Licensing. A representative of gaming or restaurant industries in the state. This position is currently filled by Paul Maracan, Senior Vice President of Government Affairs for the Vegas Chamber. A representative from law enforcement agency in a county whose population is 100,000 or more. This position has been vacant since February of this year. It was previously filled by Lieutenant Beth Schmidt of the Las Vegas Metropolitan Police Department, who recently retired. As a quick note, our office has received a recommendation from the Las Vegas Metropolitan Police Department to fill this position. We hope to have this vacancy filled before the next meeting of the task force, which is currently tentatively scheduled for April 18, 2024. I serve on the task force as the representative from the Office of the Secretary of State. And lastly, there are 4 members at large who serve in the task force. These members are chosen by the Secretary of State with priority given to persons who are sidewalk vendors or are affiliated with community organizations that represent and affiliates with sidewalk vendors. The following members are at-large members. Cynthia Moore, Environmental Justice Coalition Coordinator with Make the Road, Nevada. Paloma Guerrero, Deputy Public Defender with Clark County Public Defender's Office. Teodora Tepetzi, who's a street food vendor, and Samuel Keano, who's the son of street food vendor family. Members are appointed to the task force to serve a 3-year term. The current members were appointed on October 10, 2023, and their appointments expire on October 10, 2026. I will now go over the duties of the task force. As prescribed by Senate Bill 92, Section 14, The task force has two main duties. The first one is to review existing laws of the state and cities and counties in the state and those of other state and municipalities related to sidewalk vending. And two, recommend approaches to improve the laws of the state and the cities and counties of the state to A, legalize sidewalk vending, B, simplify and standardize laws governing sidewalk vending, C, remove unnecessary barriers to sidewalk vending, D, protect public health, safety, and welfare by ensuring sidewalk vendors follow clear and narrowly tailored laws which address demonstrable health, safety, and welfare risk, and E, develop enforcement mechanisms, including without limitation civil penalties for sidewalk vendors that operate in authorized areas. As part of the duties of the task force, we are required to submit a written report to the Director of Legislative Council Bureau on or before September 1st of each even number year, meaning our first report of the duties of this task force would be due September 1st of this year. The report must include without limitation a summary of the work of the task force and any recommendations for legislation and regulation. In addition to this, Section 25(1)D of Senate Bill 92 also directs local boards of health in a county or city whose population is 100,000 or more to adopt regulations determined to be necessary by the task force on sidewalk vending. At the direction of our Deputy Attorney General for the Office of the Secretary of State, these recommendations are to be included in the report to the LCB and for consideration of the legislature. Before I go over a brief timeline, I would like to mention some important dates that were outlined on Senate Bill 92. Senate Bill 92 required jurisdictions to adopt an ordinance on prohibited areas outlined on this piece of legislation by October 15, 2023. On or before July 1st, 2024, jurisdictions shall adopt an ordinance regulating street food vending. The task force must submit their first report to the Director of the Legislative Council Bureau on or before September 1st, 2024. And lastly, the local board of health or a city or county whose population is 100,000 or more shall adopt regulations for sidewalk vendors to apply for and receive a public health permit by December 31st, 2025. I will now go over a timeline covering the meetings of the task force and the ordinance introduced and passed so far, future meetings of jurisdictions, and tentatively scheduled meetings of the task force. On October 3rd, 2023, Clark County Board of Commissioners approved an ordinance prohibiting street food vendors from operating near resorts, hotels, event facilities, and convention centers. On October 10th, the Secretary of State appointed members to the task force. As previously mentioned, October 15 was the deadline for jurisdictions to adopt ordinances prohibiting on prohibited areas. On October 17, 2023, the Clark County ordinance related to prohibited areas for sidewalk vending became effective. That was Bill number 919-23-1, ordinance number 5073. On October 24, 2023, the first meeting of the task force was conducted with presentations from Clark County and City of Las Vegas. On November 15, 2023, the City of Las Vegas introduced their draft ordinance for licensing and regulating sidewalk vendors and voted to approve their business impact statement. This is Bill number 2023-28. On November 28th, 2023, the second meeting of the task force was conducted with presentations from the Southern Nevada Health District, Northern Nevada Public Health, and the City of Reno on their proposed ordinance. On January 17, the City of Reno approved and adopted the ordinance regulating sidewalk vendors. This was Bill number 7256 and ordinance number 6667 and 6668. On February 8th, 2024, the third meeting of the task force was conducted with a presentation from Public Counsel on their implementation of sidewalk vending legislation in California. And on March 21st, 2024, the fourth meeting of the task force was conducted with presentation from Clark County on the recently released draft ordinance. The next meetings I'm going to cover are upcoming jurisdictional meetings of the task force, as well as some other deadlines previously mentioned. During the first week of April, we expect the City of Henderson to begin their business impact statement period and introduce their draft ordinance. On April 2nd, Clark County's proposed ordinance will be introduced before the Board of County Commissioners. On April 16, Clark County will hold a public hearing before the Board of County Commissioners, and if approved, the ordinance will become effective 2 weeks after this meeting. On April 18th, the fifth meeting for the task force is tentatively scheduled. We hope to review and discuss the ordinance from City of Henderson and provide an update on the ordinance from Clark County. On May 9th, the sixth task force meeting is tentatively scheduled. We currently don't have an agenda item defined for this meeting. However, we are seeking presentations from jurisdictions outside of our state, which have passed similar piece of legislation on sidewalk vending. On May 13th, the draft ordinance of sidewalk vending from the City of Las Vegas will be heard before the recommending committee. The Las Vegas City Council will likely vote on the ordinance licensing and regulating sidewalk vendors either later in May or in June. On June 6th, we have tentatively scheduled the seventh meeting of the task force, and will likely review the ordinance from the City of Las Vegas, or if any other jurisdiction by that time has put out their draft ordinances. And as I previously mentioned, on July 1st is the deadline by when cities and counties must have adopted ordinance regulating sidewalk vending. Now, from that July 1st to September 1st is when a bulk of the work for the task force will be conducted. The task force will need to meet to discuss any recommendations for legislation and regulation. Through this period, we'll also have to work through drafting or recommendations, vote on those recommendations, and also draft review and approve the report that will go to the LCV. And again, I previously mentioned that September 1st deadline, as well as the December 31st, 2025 deadline for the boards of health. I would like to note that jurisdictions did held various town halls and community information sessions in the fall of 2023 to solicit feedback on sidewalk vending. In addition to this, the jurisdictions have also held the required business impact statement periods as part of their process for new ordinance. As you can tell from this timeline, there are a lot of moving pieces. And the work of the task force is really just beginning because the ordinance language is just starting to come out. I would like to stop here and make myself available for questions, but I do want to note that I will do my best to answer questions, but I may not have the most up-to-date information because each jurisdiction has their own ever-changing timeline. And I may not be able to comment on specific ordinances because as you all saw here, the task force still has not come up with their recommendations. We're still reviewing the language that's coming out. And again, this information is as updated as our last meeting, which took place last Thursday, March 31st. Thank you.
Thank you for the presentation, Ms. Salas Crespo, if I said that right. Committee, any questions? Senator Lang.
Chair?
Senator Lang.
Sorry. Hi. First of all, I apologize for being late this morning.
You're forgiven.
I think that I was really interested in this topic because it seems like the legislation passed a long time ago and it's taken a long time to get it into effect. And so that's been a little frustrating. I understand that pieces are moving now and that makes me really happy. But is there any way that when we pass legislation like this, you think it would be that we could get action sooner, or is it always going to take this long?
I can definitely, this is Maggie Salas Crespo for the record. I can speak on this piece of legislation and the work of the task force specifically, but I won't be able to comment on other piece of legislation. The bill had different parts of the bill went into effect at different times for the purpose of appointing and doing the administrative work for the task force that went into effect, and I believe was July as soon as the bill was signed, in June, I'm sorry, but some parts of the bill did not become effective until January 1st, 2024. And so the other things to consider with this piece of legislation in particular is that the bill had very specific deadlines and timelines. And so those timelines were preset in the bill, and that July 1st, 2024 was the timeline that the different jurisdictions were working towards. And so that is why we're just starting to see those ordinances coming out, because that is when, that's the timeline that the jurisdictions were working towards. in terms of the work of the task force, there's very little that we can do until the timelines of the jurisdictions are moving along, because we don't know what they're considering for us to provide feedback on, right? And they did begin their outreach in the fall of last year. So as soon as the bill went into effect, they did begin their outreach, but it was definitely a process because of all the different timelines and deadlines that were included in the piece of legislation.
Any additional?
Okay, so I know that.
Carry
sorry.
on. Nope, carry on.
Okay. So in looking forward, and I know you're making a report in September, is there anything that you could say now that looking back at what's happened in the last year that we should change?
Maggie Salas Crespo, for the record. I will say that one issue that we've seen come up is that there were some unintended consequences of this bill, right? But we see that happen with other pieces of legislation as well. And so one issue that we've had to face is that there's been a lot of discussion for or against this piece of legislation because of those unintended consequences that we could not have foreseen, or the sponsor of this bill could not have foreseen. And so I do believe, at least on our end, and even on potential other future bills, is just being more proactive on de-education and explaining that very convoluted bills like this that have multiple timelines or multiple deadlines, right, that we communicate that, because that was part of the confusion with the community at the beginning, that, as I mentioned, there are four different dates and deadlines that were included in the piece of legislation that made it very confusing. So I believe that's part of the reason why there had been some unintended consequences and some confusion about this piece of legislation.
Any more follow-up? I think none. Someone else have a question down south?
Chair, Assemblywoman Backus has a question.
Yep, carry on. Very good, thank you.
Okay, thank you so much. One thing that I thought was very helpful is you also included income and expenses of the task force, and that you noted that there was not appropriation allocated for this task force. But what seems to be, I guess, first, is it helpful because of the scope of the work the task force is doing is obviously translating information that is taking place for the task force?
This is Maggie Salas Crespo, for the record. The Secretary of State's office thought it was important to ensure that we had translators available during the meeting, especially because one of our task force members is in Spanish speaker only. And so that was part of the reason. But in addition to this, a bulk of the community that is going to be benefiting because of this piece of legislation or is interested in this are Spanish speakers or immigrant Latino community. And so we wanted to ensure that that information in those meetings were available to them.
So one thing that I would anticipate would be helpful for this task force going forward would be, and I guess this could be something in your guys' September 2024 report where you're looking at future legislation, would be what type of appropriation is needed for this task force. Just because already it's like adding up, I can tell just with the first few meetings that you had requiring that translation service, like a budgetary item.
Maggie Salas Crespo, for the record. Thank you. We'll definitely take that into consideration. Yeah.
Any additional questions down south? Assemblywoman?
Chair, Assemblywoman Marzola, thank you. Thank you for being here today in your presentation. You spoke about some unintended consequences. Can you talk a little bit about those unintended consequences, if you're comfortable?
Yes, of course, and thank you so much for the question, Vice Chair Marzola. Maggie Salas Crespo, for the record. I don't think that this is anything new. A lot of you have probably seen it in your neighborhoods, and we've also heard it through public comment during our task force meetings. But there have been some businesses, specifically taco vendors, that have popped up in corners with very large infrastructures that they set up that are not licensed. We see these pop in throughout the state of Nevada, throughout the city in corners, and they usually pop up at night. There's been a lot of discussion around that. Like I said, it's been brought during our meetings during public comment period. And one of the things I would like to mention is that this piece of legislation in particular was not intended for those type of businesses. The piece of legislation is very specific about licensing street food vendors, who are your corn vendors, fruit vendors that are within the community and are local here from the state of Nevada. One of the things that from our last presentation, Clark County did indicate that they have taken steps towards addressing that issue, and so the jurisdictions are taking action in those. And what we're doing on our end on the task force is ensuring that we communicate to the folks that those are two very separate things, right? Unfortunately, it was an unintended consequence, but we're still very committed to the duties that were assigned to the task force with this piece of legislation, which was reviewing the ordinances that are coming out and making recommendations and have some oversight over the implementation process. But again, we are working through the task force meetings with the different jurisdictions, and they've given us those updates that they are taking steps to curb that activity. And even in the jurisdictions that they are considering, they are starting to consider limitations on the size of the cart or the structure in order to curb that and to ensure that we maintain the core of this piece of legislation as intended.
Thank you, and thank you for that explanation. Thank you, Chair.
Thank you. Anybody up north here? Okay. Couple of...
Chair.
Yes.
This is
Assemblywoman Backus.
I can do a follow-up
Go
to
ahead.
what that unintended consequence was. Thank you so much, Chair. You raised something very interesting because I'm quite familiar with the new pop-ups because there's one that's like right around the corner from my house. One thing I noticed, and I couldn't remember in the bill because I anticipated the bill was more focused on public areas, is the pop-ups are actually happening more on private property. So I don't know... it just kind of food for thought when thinking about ordinances with respect to that, because that's what I was noticing is they're using just a public parking lot or private parking lot when a business is closed.
Maggie Salas-Crispa for the record. Yes, in the meetings that we've had from the jurisdictions, they are taking all those things into consideration and spelling it out in the ordinances.
Okay. Thank you for the questions, and everyone will get a chance at the end before we're done. But so I think you answered part of one of the questions I had on the task force is, and I know it's spelled out exactly what you're supposed to do. But so a city or a jurisdiction comes forward with a proposed ordinance, then you guys review that. Hopefully, give them some support, some things they forgot, they're not in that business, have they overreached, et cetera. So have you seen or been successful, at least to a certain degree, on getting the ordinances jurisdiction to match so there's continuity, so someone's in Las Vegas versus the county versus Boulder versus Reno, Sparks, so they're relatively consistent, so they don't have to say, oh, I crossed this line and I'm on the other side of the river now, up here in northern Nevada, so I got a whole different set of rules? Or have they been fairly consistent?
This is Maggie Salas-Crispa for the record. I will note that they are still working through that process, right? And only the city of Reno has been the only one that has passed and voted on their ordinance. It is my understanding that the jurisdictions in southern Nevada are all actually collaborating and working on this to ensure that there is some uniformity between the ordinances that they are considering. But again, they're kind of still working through the process, and the language that we've seen so far, only Clark County and the city of Las Vegas have released their initial draft of the ordinance, and so it is our understanding that they're working together and talking to each other as they're working on their ordinance.
Excellent, thank you for that, because I was just, it seems to me that part of what the task force was for was to try to herd them all in the same direction, where you guys, based on the makeup of the task force, can give them some firsthand and more practical information on how to draft those ordinances. So second question, when people have done public comment for the ordinances and various things, I don't know if you've been involved or if you have the answer to this or not, how is the public received? I mean, they've been out there for a long time. They haven't been regulated or licensed, various things, and that's what we're moving towards, so that there's not this confusion and uncertainty with law enforcement, et cetera, health department, et cetera. So how is just the public and the public comment for these things received, the vendors? Has there been a lot of pushback, or has it all been fairly favorable or just neutral?
Maggie Salas Crespo, for the record, I will say that in the public comment, what we've seen, because the last two meetings have been the ones that have had the most public participation, we have seen a little bit of discourse between the small business community and the street food vendor community. But again, part of that discourse has been because of the misunderstanding and the hardship of these small businesses in dealing with these unlicensed, larger pop-up choco vendors that, again, are not the intended target of this piece of legislation. However, I'm very happy to report that in our last meeting, after we had the presentation from Clark County, and they talked about the measures that they taken to curb that type of activity, and really explained thoroughly that, these were two very different things. We did see that the small business owners that were in our meeting, show support for their local street food vendors and acknowledge that, they are very different, and they are not the ones that are causing hardship on their businesses. And so, again, I think it's going back to that we just really do need to differentiate that those large pop-up taco trucks are not the intended target of this piece of legislation, and they are just a mere unintended consequence that is being noted by the jurisdictions, and they're working on dealing with that issue.
And thank you. And I know you're using the term unintended consequence. It seems to me, based on what you communicated, it's more of a loophole on that rather than unintended consequence. So because those larger pop-ups and some of the language that's in the bill that says, hey, you can't just uniformly exclude these people, and they were not anticipated to be in that. So it's going to take some further legislation to say, no, you guys aren't the street vendors that we were talking about, that they can't just outright outlaw, and these are the areas they can go in, you have to have an ordinance. I think they're taking advantage of the fact that it wasn't clearly defined, so it's a loophole more than an unintended consequence to me. And I know that I did get a phone call from Senator Donate, and there's a few things that he wants to look at, including the longevity or how long this task force is going to be needed once your work's completed. It's not done yet. He also was looking at other types of vendors, not only these taco pop-ups, but people that don't sell food and sell just products and various things. So we're looking forward to seeing some of that. I remember this bill coming through the legislature. Senator Donati worked very hard on it, and I think he actually landed in a pretty good spot. And now we're going to fix the things we didn't intend to happen and the loopholes that are popping up as a result of that. So I thank Senator Lang for bringing this forward so we can get an update. The continuity of the ordinances, I'm glad you guys are working on that. I think that's an important element. May take some legislation as well. So you don't really have a recommendation for us at this point. I think it's premature for any type of sunsetting on that. So likely we're going to end up with a continuation, and we'll see what comes legislative-wise in the next session. And we'll try to follow up with the senator that sponsored the bill as well. Any other questions from the committee? Seeing none, thank you very much, Ms. Excuse me, I turned off my mic. So if there's no other questions, thank you for your presentation. And we will move on to our next item, which is agenda item 4E, the Advisory Board on Automotive Affairs. And we have J.D. Decker, I understand, in Southern Nevada from the Department of Motor Vehicles. Please proceed when you're ready.
Good morning, Chair Daley, committee members. I am J.D. Decker. I'm the, the Chief of the Compliance Enforcement Division for the Department of Motor Vehicles. I'm here to discuss the Automotive Affairs Advisory Board. I am the DMV appointed member to the board, and my division administers the meetings. The board is created within the department and administered by department staff under NRS 482.002. The board is required to hold 2 meetings per year that are generally held by telephone or video conference. Board meetings are scheduled by department staff, and the board is authorized to make recommendations to the department regarding regulations and proposed legislation by the department, and to study the regulations and licensure and any and disciplinary action trends within the industry that are imposed by the department. Currently, we have about 3,500 licensees. These are professional licensees like dealers, garages, body shops, etc. That would be subject to the department's regulations, licensure, and disciplinary action, and that the board would represent. And I'm happy to answer any questions you might have.
Committee, any questions up here in the north? Seeing none, down south? No questions down south? So I'll just ask a couple. I know this particular board, advisory board, I was looking up the legislative history, goes back to 1989. So can you give us a little bit of information on what was it intended to do? Is it still meeting that? Obviously, if they're not meeting and can't get quorums, it's not meeting their intent. Are there other avenues where you guys can gain this information, or is it really information you still need? There's associations that cover a variety of these different business entities and various things, so they have input to you guys on what regulations or how you may enforce or what the issues are. So your conclusion is the board's probably not needed any longer, but is some of this work that it was originally intended to cover being performed in other fashions?
Chair Daley, thank you for the question. J.D. Decker, for the record. So the board was probably originally a very good idea in the sense that it allowed a formal opportunity for industry at large to provide feedback to the department on department regulatory actions that affected the industry. We currently have 10 members in law that are required to be appointed. I think we're at 6 currently today out of 10. It's very hard to find members to volunteer to apply for the board. I think 6 is the most we've had in the 6 years that I've been on the board. With 6 out of 10, it's therefore very hard to establish a quorum to hold meetings. We've had to reschedule numerous meetings based on one person not attending and not having a quorum. Currently, in the modern day, we industry divided by sector generally has trade organizations that serve the function of liaisoning with the department, providing feedback, bringing up issues, supporting or opposing or proposing legislation that the department might present to the legislature. Those trade organizations often have lobbyists who work very closely with the department and are able to sometimes on a daily basis have back and forth interaction, whereas the board meets twice a year and doesn't have necessarily industry representatives other than appointees that the department discusses those issues with during those 2 board meetings. So I think currently, in all practicality, the trade organizations provide much more timely, consistent, and relevant feedback to the department than the board does. We don't have a strong showing of trade industry representatives currently appointed to the board. We have some, but the trade industries aren't generally represented, so we're not getting the broad focus on the board that we would get from the trade industry or their lobbyists. So currently, the board has not proposed any regulations, it's not proposed any legislation or recommended that to the department. Currently, the department would report back to the board legislative or regulatory issues that are going on for their information, but it's not generally the board that is driving the department's direction. It would be trade groups and their lobbyists. So I would say currently it's still a way to discuss issues with the industry, but I'm not sure we're getting the broad industry representation that the board was originally intended to establish. Thank you.
No, thank you for that. I just wanted to make sure I understood. So the appointments are all by the governor, if I remember correctly. And they're not necessarily with recommendations from the various organizations or groups or various things. So whoever that person may be may not really represent the overall industry. For instance, the smog check guys. It may just be one guy that's, got his opinion, and that's what he's putting forward on the board. So it's probably not that broad representation that you're trying to look for. Final question before you comment on that is, before the department moves forward with a regulation or proposed changes in legislation or some of the things that you guys might be doing, you have a process and a program to reach out to the various industries and various things to do public comment. I know you have that under regulation and various things, but you guys have a program in order to solicit the comments to make sure you're not running afoul of common practices and adversely affecting businesses.
Thank you for the question, Chair Daley. J.D. Decker for the record. That is correct. Your first assessment is accurate on the representation on the board. It's not necessarily trade industry representatives. It's generally licensees who may represent themselves and a constituency of other licensees of similar types, but it's not necessarily the people that are involved in the trade organizations that represent the industry or the sector as a whole. In answer to your second question, because the board meets twice a year, it's relatively impractical to obtain approval, let's say, or a recommendation from the board prior to the department either proposing a regulation or going through the rulemaking process to establish a regulation, because the timing just doesn't work that way to where the department can wait for the next board meeting. So what the industry or what the department does generally is use the board meetings as a opportunity to discuss with industry and the board representatives what the department has undertaken in regard to proposing legislation or regulation and where the process is. But it doesn't necessarily seek approval, and the board doesn't necessarily have the authority in law to deny approval. Again, the authority of the board is to make recommendations to the department. So we solicit that input when we do have board meetings, but it doesn't drive the department's actions one way or the other. Thank you.
Very good. Committee, any further questions before we move on? Seeing none, thank you, Mr. Decker, for your presentation. And this board may be one that has outlived its usefulness, and we'll take that under consideration at a later meeting. So, thank you.
Thank you.
Okay, with that, we are going to move on. We're moving at a fast pace this morning, so we're happy. Agenda item 5, which is our second period of public comment. So we'll be taking that. We'll limit anybody that's here or in Southern Nevada, doesn't look like any, to 2 minutes. If anybody has any public comment. Seeing none in Clark County. Seeing none in Northern Nevada. Broadcasting, do we have anybody on the phone?
Thank you, Chair. The public line is open and working, but there are no callers to provide public comment at this time.
Okay, with that, we will close agenda item number 5. We only have one more, just a couple of comments before we adjourn. We will be having our next meeting coming up. I think we have 8 boards or panels left to review. And I know we're trying to get the High-Speed Rail Authority for next time. We're working on a couple others, but I do believe the only other one for sure is the charter school authority, so we're looking forward to hearing from them at our next meeting. What date is that? The 23rd. 23rd of April. So with that, if nobody has anything else, we are, let me get the gavel. Adjourned.
Very official.
Thank you.